Eric Hammer here, registered physiotherapist. Today, I'd like to talk to you about how you can decipher tightnesses in different muscles in through the hip and how that might be helpful in terms of treatment plans moving forward. But before I continue, please hit that subscribe button below so you'll be notified about any new videos I have here on my channel. So essentially, I want to talk about, there's three different areas within the front of the hip area that can get tight. So in a lot of cases with the hip, these muscle imbalances can take place as a result of certain weaknesses, right? So for example, weaknesses in core strength, weaknesses in glute strength. And as a result of this, right, the body has to naturally compensate and overuse certain muscles to compensate for this. So some of the muscles that we'll potentially overuse are going to be your quadricep muscle, so your rectus femoris muscle specifically, which is the one that's right kind of in the center of the quadricep muscle here, your iliopsoas muscle, or essentially your hip flexor, and then your IT band, which is basically this connective tissue that runs from the hip all the way down to the knee area. And so one of the tests is called a Thomas test, can be helpful in terms of identifying, right, which one of these muscles might be creating a tightness, right, in through that area. So essentially, I'm just going to set up my table here. I'm just going to move this out to the side slightly here. And so the idea, right, is I would have the patient go right to the edge of the table, okay? And then they're going to be lying on their back, so like this, okay? And then from there, you're gonna bring your opposite hip. So let's say I'm testing out the tightness in through my right side. I'm gonna bring the opposite hip up, and then I'm just gonna let my right hip fall downwards, right? Now, ideally, like I'm a little bit tight right now, ideally we'd want this hip to be more or less in line with the table. So in order to identify, right, different structures or different muscles that might be involved here, right? So the one thing I would start to do is I'm going to extend out that knee. Right now, if my leg drops, which it has been slightly, right, that's going to identify that, hey, that quadricep muscle is the one that might be tight out of these three, right? Because when I'm extending it forward, all of a sudden I'm gaining, right, more range downwards, okay? When I go back to, again, that knee being bent, if I move it laterally, my hip out to the side, and if it falls, which right now it's not, my IT band might be involved here, right? And so if there's no movement whatsoever between the two, right, that would then mean that my psoas muscle is probably the muscle that's tight in these instances. So what I would say for myself here is that I've got a really, really tight rectus femoris muscle, because as soon as I extend that leg out, right, now I gain more range. When I bend it and put it on a stretch, my hip essentially moves upwards. So it's a nice little test, right, to decipher between what muscles, right, might be involved. So knee extension, rectus fem, lateral rotation for the hip, IT band, and then the other one, of course, is if that doesn't change, iliopsoas muscle is involved. Okay, so those are the three little tests that you can do. Great little exercise for to again identify. It's a great sort of testing mark for physiotherapy, and then as a result of being in that position, you can then treat potentially the muscle that might be shortened as a result of those. Thanks again for watching. Please make sure to check with a physiotherapist or a doctor to make sure that this or any information is appropriate for you, and have a great day. Thanks so much. Take care.